Good morning. Welcome. We're just going to give a short routine to join. I see people are still joining. Welcome to our first webinar for 2025. We just give folks another minute as they're joining. Hi, everyone. I am Elizabeth Baini, Research Specialist at Ilifa Labantwana, and I will be your facilitator for today. Welcome to our first webinar, the Early Childhood Systems, Perspectives, and Research webinar series. This is a joint initiative of Ilifa Labantwana, Research on Socioeconomic Policy, that's RESEP at Stellenbosch University, and Data Drive 2030. So this webinar series is for us a learning session to explore the latest perspectives, research on various issues affecting the early childhood development service delivery ecosystem, and to create change for children by promoting data and research. So to those who are new here, you're most welcome. We have this monthly. And to those who are returning, welcome back. We promise this year is going to be a fun-packed learning session. Good morning, everyone. So a few housekeeping before we kick off. We've got a question and answer tab at the bottom where you can post your questions and interesting comments for discussion or engagement after the presentation. Or you have the option of raising your hand during the question and answer session to pose your questions or comments to the presenters. All right. So on our first Early Childhood Systems, Perspectives, and Research webinar series, we felt it was important to start off strong by looking at a really interesting aspect of ECD and where we go towards our vision for 2030. As you may all well know, South Africa is committed to universal access to early childhood development, including 2 years of quality preschool by 2030. This, in all intents and purpose, is a really ambitious goal. But current enrollment data shows us that we are quite a bit off track from achieving this ambitious goal of universal access. So in order to course correct, we will require concerted efforts to increase access for all children who are locked out of early childhood development services. So the DBE's 2030 ECD strategy proposes some enrollment targets to make this universal access possible. And a big part of that success of this expansion strategy in the 2030 document is reliant on adequate supply of a capable workforce. That is the people, so the practitioners and assistants that are actually going to deliver the services of early childhood development. So in today's webinar, we want to explore the human resources requirements needed to support the policy expansion goals that we have set for ourselves for 2030. And no other people, no two people are more well-versed in helping us unpack some of these HR questions than our presenters for this morning. So this morning we have with us Dr. Gabrielle Wells and Dr. Grace Leach. Before they present or help us to understand the human resources requirements needed, let me tell you a little bit about them. Gabby Wells is an education economist, currently a senior researcher at RESEP, and is She's a senior researcher at RESEP and a senior lecturer in the Department of Economics at Stellenbosch University. Her research focus areas include systems reform in basic education, early grade reading, ECD. She is currently leading a project titled COVID Generation to track the impact of the COVID-19 pandemic on educational outcomes and trajectories of South African youth. And her co-presenter this morning, Dr. Grace Leach, is a developmental economist with an interest in poverty and inequality. Her PhD in economics of early childhood development explores the intersection of economics, spatial inequality, nutrition, parental investment, and education to improve child welfare. She currently works for the DG Murray Trust and has been seconded to the National Treasury as a technical analyst on public finance for early childhood development. So, colleagues, we are in great hands this morning. And without further delay, I give it over to Grace and Gabby to help us understand the human resources needs for expansion of ECD towards our universal goal. Thank you.
Grace, are you able to see the
presentation? Thank you so much, Elizabeth. Much appreciated. Yes, I am. Elizabeth, can you give us a thumbs up if you are also able to see everything? Great. Thank you very much, and thank you to everybody for joining us this morning. A very warm welcome, and we hope that, this will generate good discussion and good questions afterwards. So as Elizabeth has mentioned, we are looking at practitioner requirements in early learning programs and looking at current sort of estimates and the future requirements for the lofty goals we have of expansion of our ECD sector. This is work that Gabby and I undertook last year, and we really hope to discuss it further with you. So the rationale for the study is, as Elizabeth mentioned, that access to early learning facilities in South Africa is limited, where we estimate around 35% of 0 to 5-year-olds access early learning facilities, according to 2022 data. This low access to early learning facilities means that a considerable effort is going into expanding access, driven by this 2030 ECD strategy, which I'm sure many of you are aware. This includes expansion of existing ELPs to further generate capacity, as well as the creation of new ELPs. Depending on the age group, the 2030 ECD strategy targets different levels of access, ranging from 30% of 0 to 2-year-olds in early childhood care and education, up to 95% of 5-year-olds. We know that different age groups will require different amounts of access, and we are sensitive to this, and so is the strategy. So achieving this targeted access in the 2030 ECD strategy will require considerable expansion in the supply of ELPs throughout the country, and this obviously has workforce requirements. We know that expanding ELPs requires expanding funding, infrastructure, and workforce, not just the workforce, but this research really just models the necessary expansion of the workforce, which would be required to meet the targeted ELP enrollments in the 2030 strategy, and which complies with regulations set out in the Children's Act. Moving on to just looking at the research questions more specifically, we wanted to look at how many practitioners there are currently in ELPs. This is, while it might seem a simple question, was actually rather difficult to get to. We wanted to look at the qualifications. How qualified are current ELP practitioners? What are their characteristics? How much are they paid, etc. We wanted to look at how many ELP practitioners we will need by 2030 to meet the ECD strategy targets and comply with minimum child-to-practitioner ratios. And then we ask the simple question, is this expansion feasible? What is required for this expansion? And looking at what expansion would look like. So the outline of our research, firstly, just to define early learning programs. we defined as preschool, nursery, or educare systems, which may also include grade R, but which are centers, so non-school based. ECD learning programs and centers may also include day mothers or gogos and playgroups, but we do not consider grade R practitioners in schools as ELP practitioners, as the focus of this research is on non-school-based ELPs only. We do understand this is somewhat of an artificial delineation because ECD does stretch between school and non-school, but we've looked just at the ECD sector. So moving on to an outline. In order, the first step is really to estimate the enrollment in the early learning programs in South Africa, which was quite an undertaking. The second is then, based on those estimates of enrollment, is to estimate the current ELP workforce numbers, and then estimate the future ELP workforce requirements based on the strategy, 2030 strategy, as well as the Children's Act. And then fourth, we look at the current ELP workforce characteristics and what would be required to take the current workforce into the future requirements. And with that, I am handing over to Gabby to take us through the estimations of enrollment.
Great. Thanks, Grace. In this modeling exercise, and really we are taking you through a modeling exercise, we've had to, as a key kind of input into the process of estimating, first of all, the current ELP workforce, and then kind of what is the gap to our requirements with respect to meeting targets in the ECD strategy. A key first point is to estimate enrollment in early learning programs in South Africa. And I just want to reiterate this. There are many estimates of the size of the early learning program, and I'm using that term specifically so that I can distinguish that out from school-based ECD. So I'm talking specifically throughout this presentation on non-school-based ECD, which we'll refer to as early learning programs, just for a point of clarity and delineation. But what's very important to know is that there are many estimates of the size of the early learning program enrollment. And this is because we don't yet have an administrative system like that exists in the basic education system, where you have a very clear set of enrollment numbers that are provided by schools. We need this for early learning programs, and there are many efforts currently underway to be able to do this for the system. But up to this point, we've always relied on surveys and household surveys to get an estimate of the number of children that are attending early learning programs. And surveys themselves are subject to measurement variability, measurement error, but also there are perceptions around when a person is asked a question about whether their child is attending a creche or a nursery school or a preschool or grade R or school. People have different perceptions often around what those things mean. And so a lot of the measurement error is also driven around differing perceptions of what those things are. Nevertheless, people have done their best. And you'll also probably find yourself thinking, well, there's so many different estimates of the size of the ELP sector in South Africa. And this really, given where we've been in terms of the information that we have, is to be expected. So this is our take on how to get an estimate of the size of the early learning program system. But it is just that, an estimate, and it's the best that we can do with the current available information. So our approach is somewhat different to what other people have typically used. What we first do is try and identify the total number of children that are aged 0 to 6 in South Africa that are in any education or care. And then we take that number and we subtract the number of children that we know are currently in school of that age in the schooling system, whether it be in independent schools or in private schools. And this will give us a sense, we think, of the number of children that are enrolled in non-school-based early learning programs. Okay. And so basically there's 3 steps to this. So we use the General Household Survey ECD question to identify the proportion of children aged 0 to 6 attending any education or care facility. We then multiply that by the number of children in the population aged 0 to 6, which in itself is also an estimate, and we will show you how there's much variability in this. Number 3, we subtract the number of children aged 0 to 6 enrolled in ordinary schools using administrative data from the LURIT system in South Africa. And then we kind of say, well, let's use the ECD census of 2021. We know that it's potentially undercounting the number of programs and the number of enrolled children, but at a minimum, it should give us a minimum level of what we should expect in terms of the number of children enrolled, say, for example, at a provincial level. So we use that to adjust upwards. We can't get an estimate that is lower than what the ECD census of 2021 says. We think that would be that would not make sense. And this really gives us the total number of children aged 0 to 6 in non-school-based early learning programs. All right, and we need this number because we need this to be able to model the number of current practitioners, ECD or ELP practitioners that exist in the system. All right, so just another point of clarification. We have used age 0 to 6 for identifying the number of children in the ELP system in South Africa, and as an indicator of the size of the early learning program system in South Africa, and rather not using 0 to 5. And the reason is this: if you're going to be estimating the current size of the early learning program workforce, we need to be considering all children in that system. And that's regardless of their age, because that's currently how it's run. And it's just important to point out there are a sizable number of 6-year-olds in early learning programs if we believe the data that we currently have. So the quarterly labor force survey, for example, suggests that about 19% of 6-year-olds are enrolled in educational care in a preschool. It seems quite high. But if we go to the 2021 ECD census, which was conducted in a time when where the economy was very much still trying to recover from the COVID-19 pandemic, the system had been hit quite hard. And in that data set, of the children that have birth dates, 7.2% of those are 6-year-olds, and that's about 90,000. And that would significantly undercount the actual number of 6-year-olds that are in the system of early learning programs in a non-school-based environment. So that is our rationale for the reason for why we use the 0 to 6 age category. Right, now we get an estimate from the GHS survey of the proportion of children that are in any kind of learning environment, and we have to multiply that by a population number. This is somewhat challenging. We have not been able to use the 2022 population census. And the reason is that there is this very large drop-off in the estimates of 5-year-olds, and this was when we last observed the population estimates that were on the online system. And that large drop-off seems highly improbable, and yeah, so we were concerned about that. It either suggests high infant mortality, which is not supported by other data, or dramatic surges in fertility in alternate years. That doesn't seem to make sense. And then there are multiple other population estimates. So we've got Tembisa estimates for 22, 23, 24, which are plotted there. We've got the UN World Population Prospect numbers that are plotted there. We have the mid-year population estimates from Statistics South Africa, which are also plotted there. And at the end of the day, we just decided to go with the Tembisa 2022 population numbers, which are roughly about around 8 million children aged 0 to 6, and about 6.87 million children aged 0 to 5. Some would say that these are potentially too high. The mid-year population estimates are slightly lower, and even those people might say are potentially too high. But as you can see, this is a major point of variability, and it's an important point that does affect the numbers that we get. What about enrollment? So by the time we look at the GHS, and then we multiply those numbers by our population estimates using our 4-step method, we identify that about 2.59 million children aged 0 to 6 are in early learning programs in South Africa, which is about 32% of all children aged 0 to 6. But we know that there is variability in how things are measured, and so you have to place this within a band of confidence with which you believe the estimates. And so that could range anything between 2.4 million and 2.65 million. But it doesn't mean that only 32% of children are enrolled in any education. If we consider that there are 6-year-olds and 5-year-olds in the schooling system, it bumps up our numbers to about 4.1 million children in any education or care, which is about 52% of that group. But again, that number lies within a range which could be anything between 4 million and 4.2 million. If you're only interested in children aged 0 to 5, then we estimate about 2.4 million children aged 0 to 5 in early learning programs in South Africa. And I think it's important to reiterate our definition. That also includes attendance at a day mother, at play groups, at preschools, basically anything that is not school. All right. Where are these 2.59 million children that are enrolled in non-school-based early learning programs? Where are they in the country? If we use the GHS to get a sense of where those individuals are, you will see that there is a disproportionate share of these children are attending early learning programs in Gauteng province. So of that total of 2.59 million, 28% are in the Gauteng province, followed by Limpopo at 18%, Western Cape at 14%, and KZN also around 14%. So that just gives you a sense of where these children that are being serviced in early learning programs are currently situated in the country. Now, we've had to be quite sensitive. We have had no choice but to be very sensitive to age and in this modeling exercise, because as soon as we start thinking about and trying to identify the numbers of ECD or early learning practitioners in the system, and in terms of what we're going to need, due to the fact that there are very different legislated child to practitioner ratios by the age of children, it does mean that we have to have a sense of what the numbers are of children enrolled in early learning programs by age. And this is what we identify. So the first thing to note is, so I show you what the total population number is of children by age using the Tembisa 4.7 statistics from 2022. So those are the numbers of the total number of children estimated of those age groups. Then these would be the numbers of children that we identify in any educational care. And then finally, we have the numbers of children in a non-school-based early learning program. As you can see, the total for age 0 to 6 is the same as what I've been saying. It's about 2.59 million children in a non-school-based early learning program. But importantly, the number of children that are enrolled in any type of age care that are aged 0 to 2 is virtually the same number as the number of children aged 0 to 2 that are in early learning programs. But this is very different when you look at 5 and 6-year-olds, where because many 5 and 6-year-olds have already entered into the public or private schooling system, that we find that about 93% of those kids aged 5 to 6 are in any educational care, but only 25% are in non-school-based early learning programs. All right, so I'm going to hand over to Grace now. So having given you the background around the basis for our modeling, which is early learning, the numbers of children enrolled in the early learning program system, Grace is now going to add on to that and explain to you how we now move from these enrollment numbers to getting estimates of the size of the current early learning program workforce in South Africa. Grace, we can't hear you.
Thank you so much, Gabby. And as Gabby mentioned, we have been sensitive to age, but unfortunately, based on the data that I am unmuted on my side.
I think it's a connection issue, but I think it's better now.
Can you hear me? Apologies. So moving on, as Gabby mentioned, to estimates of the current ELP workforce numbers. So we follow a very simple method to get to these numbers, where we take the estimated ELP enrollment and we multiply it by different estimates of child to practitioner ratio estimates to arrive at the ELP workforce or ELP practitioner estimates. Now, we have been very sensitive to age in our extrapolations of the future requirements or our estimates of what we need, but unfortunately, we do not have data on age-specific child to practitioner ratios in facilities. We can get to some kind of estimates for some provinces and in some cases, but we just didn't feel it reliable to base our estimates for the current workforce numbers on on sort of estimations based on very few facilities. So we've taken a national approach, really. And we've used two primary data sources to come to these figures. The first is the 2021 ECD census, and the second is the 2021 baseline survey. So we took different child to practitioner ratios estimates into mind. So the first was based on the 2021 ECD census, where we took all of the children enrolled and divided by the practitioners, where managers were included. So we assumed that managers teach, but no support staff teach. And if we do that calculation, we come to an average of 12.4 children per practitioner in South Africa. Moving on, also using the 2021 ECD census, if we take all of the children enrolled and we divide it by just the practitioners, so we assume that no managers or support staff are teaching children, we come to an estimate of 18.3 children per practitioner. According to the baseline audit, this is ratio 3, if we just take the 2021 class size, we had an average of 23 children per practitioner, and this is just per practitioner. The baseline audit pre-COVID class size was 27.4 children on average per practitioner. And if we just take an estimate of all children enrolled to all staff in the ECD 2021 census, we come to a ratio of 8.9 children on average per practitioner. So as is evident to see, these estimates of child to practitioner ratios really do vary based on the assumptions that you make. And in reality, some programs may have managers and support staff teaching and other programs may not. And we can't really distinguish between that in the data. So what we've done is used all of them and sort of seen where the numbers lie and what they can tell us. So if we multiply the estimated enrollment by the inverse of child to practitioner ratios, looking at both ELP practitioners and then the whole workforce, we come to a few estimates. So the bars in this graph show the current practitioners based on our enrollment, and the estimate based on ratio 1 is 208,000 practitioners, based on ratio 2 is 141,000, all the way down to 94,000 if we take the pre-COVID class size ratio into account. Now, this is very different estimates, as you can see, but the ECD census does report total teaching staff for facilities, and this is about I believe 167, Gabby, if you'll just show that line for us. 165,000 total teaching staff. So if we take, if we adjust this upward based on the ratio 1, 200,000 practitioners seems a reasonable estimate of just the practitioners and assistant practitioners currently in the system. So this is based on the 2022 enrollment. So we know that there are at least 165 total teaching staff. And if we know that in some facilities, support staff teach, etc., we estimate around 200,000. With additional managers and support staff attached to ELPs, we estimate the size of the current ECD workforce is roughly 289,000 in 2022. So this is really our best guess at the current size of the workforce. But now our task is to move on to estimating the future workforce requirements. In order to do this, we also use a 4-step method. So firstly, we get an estimated population of the 0 to 6-year-olds. We use the same population estimates as Gabby mentioned. And then based on age groups, so the 0 to 2, 3 to 4, and 4 to 5 age groups, we multiply it by the targeted ECE coverage to get the number of children in ECE under targeted enrollment by age group band. So to account for the share of children who attend a school-based program, we get the ratio of current children who attend a school or ELP, as Gabby mentioned. I will elaborate on that. And so now we have the number of children by age group who we believe should be, who we are targeting to be in an ELP, in an early learning program. And then we multiply this number by the child to practitioner ratios that are required in the Children's Act. And this, after this 4-step method, we arrive at the number of practitioners required to meet early learning program or childhood care and education targeted coverage by 2030. So just to pause, and I'm sure many people are aware of this, but the ECD Strategy 2030 targets participation by age group, which are for 0 to 2-year-olds, 30% are targeted to be have access and be enrolled in early learning centers. Age 3-year-olds, around 70% of them should have access. For 4-year-olds, 85% should have access. Age 5-year-olds, 95, targeted access is 95%. And while the 2030 strategy does not mention 6-year-olds, we assume that 100% of 6-year-olds should either be in school or in an early learning center. So this is the targeted participation in any kind of early learning, school or non-school. But because we are interested only in ELPs, we take the share of children enrolled in ELPs versus the share in a school-based program. I just want to pause here and say that we did this work while the Bella bill was still a bill, and it is now the Bella Act. And this has huge implications for our 5- and 6-year-old estimates. I don't think that we are far off, that 100% of 6-year-olds are now required to be in school, really, or in an accredited, grade R program. So the share of children aged 5 to 6 in a school-based program may increase as BELA becomes implementable and common practice to send a child to grade R in school. But we do still stand by our age 3 to 4 and 5 shares here. So based on survey data, sorry, Gabby, can you just go back? We estimate that around 98% of age 3 to 4-year-olds are in an ELP as opposed to a school. A share of 40% of age 5-year-olds are in an ELP as opposed to a school, and around between 28 to 30% of age 5 to 6-year-olds are in an ELP as opposed to a school. So if we multiply these shares, thank you, Gabby, by the population of 0 to 6-year-olds, we get the targeted number of children who we think by age group are going to need to be in an ELP. So once again, we have the population estimates, the number in any educational care, the number in a non-school-based ELP, so that's the red bar, and now we need to compare that red bar to the targeted number for ELP enrollment based on the 2030 projected population. And we can see that for 0 to 2-year-olds, this number needs to go from 694,000 to 1,084,000. And this is really the largest gap. For our 5 to 6-year-olds, the number jumps around 40,000. So the targeted access needs to expand by around 40,000 children. And overall, we need to expand access to ELPs by around 1 million, for 1 million children. So now that we know the sort of targeted, the current population, the current enrollment, and the targeted enrollment, we have an idea of the gaps. So this is the gaps of how much the system needs to expand by in order to really serve and meet the targets in the 2030 strategy. And this is where the age groups are important. So we can see that there's a large variation in the expansion that's necessary, specifically of the ELP sector. But we do know that the schooling sector is also going to have to expand slightly with our 5 to 6-year-olds moving into grade R. So we know that this research touches on that topic, and we are engaging in the grade R overlap between schools and ECDs. But yeah, this is the expansion that we model based on the number of children who will require enrollment in ELP. So now that we have the enrollment gaps, we can move on to the future requirements for ELP practitioners. So here, these numbers you'll recognize. For the 0 to 2, 3 to 4, 4 to 5 age groups, we multiply this by our child to practitioner ratio 1 and ratio 3 to estimate the current ELP practitioners. Now, this is, so those will, in the red, will give us the number of the current that we estimate. And this is just a practitioner, so a teacher, the main teaching staff that is going to care for children. If we multiply the number required, so the required ELP child to practitioner ratio, we get a total of 267,000, almost 268,000 practitioners.
Grace, we've lost you. I'm not sure what's happened, but I can take over, Elizabeth. It's fine.
Yes.
Basically, we get to a point where we estimate that roughly we will need about, so what is required in terms of meeting the ELP enrollment, meeting targeted ELP enrollment with compliant child practitioners, and using 2030 projections in terms of the number of children that will be in the system, we estimated that we would need about 267,000 practitioners to serve children aged 0 to 6. But the requirements are very different by age. Because the majority of the enrollment expansion that we want to see is for children aged 0 to 2 and 3 to 4, the majority of the additional requirements in terms of where we need these ECD practitioners will be for these younger age groups. As I said, very importantly, these things are based on numerous different estimations of the child practitioner ratios. We don't have specific child practitioner ratios by age, and so our age-specific modeling is very, there's a big disclaimer attached to how accurate that is. But basically, we need to go from a situation of having, at most, we think about 200,000 current ELP practitioners, which potentially includes assistants, to having needing about 267,000 practitioners. Grace, are you back? Do you want to carry on with assistants? Okay. No, we still can't hear you. Okay, so if we think about assistants, the Child Act, or the Children's Act, requires that there's not only a practitioner for each child in a certain ratio, but that they also need an assistant. And so what it means basically is doubling up. So we might need 267,000 practitioners to be able to meet the targets for early learning program expansion with respect to enrollment. But on the basis of current legislation, you actually need to double that with another 267,000 assistants. And again, just to reiterate, the bigger need is really for younger children. And the reason for that is that the child practitioner ratios are very different by age. So for example, 5 to 6-year-olds in South Africa require, there needs to be one practitioner for 30 children. But for children that are aged 0 to 18 months, it's 6 children for every practitioner. And for 18 months to 2 years, it's 12 children for every practitioner. And for the age 3 to 4 group, it's 20 children for every practitioner. And so the result of that is driving these much larger requirements or needs at younger ages. And so I think we can really focus on the bigger number for the whole group of age 0 to 6 because of the disclaimers we have around our not having child-specific current information on actual child practitioner ratios in South Africa that are age-specific. But that's really our need at the moment. So moving on to the characteristics of the current early learning program workforce, which really just helps to put this whole thing in perspective. There's a big numbers game in terms of needing additional early learning program practitioners to be able to service this targeted expansion in the system in terms of enrollment. But we also have to face the reality of where the system currently is with respect to the characteristics of those that are currently in the early learning program workforce. So we use multiple data sets to be able to get a sense of who these individuals are currently in South Africa. So we've relied on the 2021 ECD census, the earlier ECD audit of 2013 and 14, the 2021 baseline assessment, and then the quarterly labor force survey as well, which is usually not used for this type of analysis, but we have. And the reason is because we can identify individuals to a low-level occupational code in the quarterly labor force survey. And specifically, there are codes for pre-primary education teaching professionals or associates and childcare workers. This is not an exact science. I mean, some of them might not be specifically in ELP programs, but it does give us a sense of who these individuals are and what their qualifications and working conditions are like. So this is using the quarterly labor force survey. And this gives you a sense of the proportion or the percentage of ECD-related workers, so these ECD professionals, pre-primary professionals, or childcare workers that have a matric. And I compare that to the primary level teachers that are identified in the quarterly labor force survey that have a matric. And you can see there are vast differences. In around 2018 or 2019, up to about 56% of ECD-related workers were identified as having at least a matric, compared to nearly all primary school teachers, thank goodness. We would hope it's all, but there might be some measurement error here. But if we break it down by higher level qualifications, while 89% of the primary school teachers identified in the quarterly labor force survey have a tertiary qualification, and in reality, it might be more than that. But only 16% of ECD-related workers had that level of qualification. And so this idea that, that we can suddenly get all ECD practitioners into tertiary-related education is really, it's a problematic notion when we deal with the reality that, you know, almost half of them haven't even finished school with a matric certificate. All right, so does this correlate with anything that we know from previous data? And it actually does. It correlates quite well with what we saw in the earlier 2013 or 14 audit, where we identified about 45% of ECD practitioners had at least a matric, which is not far off from our 55%. And we would have expected over time more educational or school completion. What about some other characteristics? And I thought this was quite interesting. If we take the quarterly labor force survey and we look at the age of ECD-related workers, their education, whether they're underemployed, whether they're identified as being in the informal economy, or trade union members, and their hours worked, we see quite significant differences between themselves and primary teachers. So they are younger on average. They are almost all female. So this is the early learning program system with respect to that workforce it's virtually all women in that system. It appears that this is the case here. But this is an important point. Only 7% of those ECD-related workers in the quarterly labor force survey were identified as currently studying, despite their very low levels of education. So upskilling is not common. It's not a thing that's happening en masse, and that needs to be recognized. Almost a half are in the informal sector, so roughly 49% over here, as opposed to 1.4% of primary teachers. We would expect that, though, to actually be 0, but there is measurement error. On average, ECD-related workers appear to work more hours than primary teachers, but I'm going to show that there is much higher variation, as we would expect in those working hours. 8% of ECD-related workers are trade union members, although there was high non-response to this question, as opposed to 3/4 of all primary teachers. And only 3.1% of these ECD-related workers identified themselves as being underemployed. They weren't working enough during the week. And that's interesting, despite the fact that they have low wages. And just to show you how much variation there is in the hours worked by ECD-related workers, this is a box plot. This line over here shows you the median amount that they earn. The top shows you, this line over here shows you the hours worked at, I'm talking about hours worked, shows you the hours worked at the 95th percentile, and this line over here is at the 5th percentile. And you will see that and then there's a lot of these outliers, and that kind of varies more. And particularly in 2019, we've seen much more variation in hours worked of ECD-related workers compared to primary teachers. What about salaries? There's nothing in the quarterly labor force survey that's publicly available that I could get on this, but the baseline assessment technical report had some, I think, quite revealing information. If we were to look at 2021 as a year, the minimum monthly wage was 3,760 Rand. Almost 90% of the ECD practitioners, early learning practitioners that were surveyed in the baseline assessment of 2021 earned less than 3,500. So they were certainly earning less than a minimum monthly wage. And then just a last little thing of interest around the characteristics of ECD-related workers is their age. So in the basic education, there's been a concern around the aging profile of teachers in the system, both primary and secondary level teachers. They've been getting older, and it's been happening in a wave, largely due to when there was a restructuring of the system in early kind of post-apartheid. And as a result, we had this kind of movement of teachers into retirement. And so if you look at the orange line for primary level teachers in the quarterly labor force survey in 2010, that's very much to the left of the more recent 2019 line in yellow. But for ECD-related workers, we haven't seen the shift. Their age is much more distributed evenly across the age distribution. There are many more younger teachers, and there is a much more even spread. And so we don't see this kind of retirement wave issue in the ECD-related, in the ELP system or ECD amongst ECD-related workers. Right. So just coming towards a conclusion or end, I want to take you back to this final slide around the future requirements for early learning practitioners. To reiterate, it appears that the vast majority of the expansion in early learning program practitioner requirements relates to serving children aged 0 to 2. Okay. And at a minimum, the ECD workforce required is basically around 536,000 practitioners and assistants, which is basically at least more than a doubling of the current number of individuals that we think could be in the system working as in the ECD workforce. And the reason for why this vast majority of expansion in early learning program practitioner requirements relates to serving these younger children is for two reasons. The enrollment gap between the current and the early learning program strategy targeted enrollment is the largest for the age 0 to 2 and the 3 to 4 group. And then we have these very low child to practitioner ratios legislated effectively in the Children's Act for children under 2. My assumption is because of this, we are unlikely to see this expansion in enrollment amongst the younger groups. And this is for two reasons. That expansion is unlikely to happen unless, first of all, there's much more expansion in early learning program enrollment amongst the older groups that are less costly to serve. And I'll give you an example of my reasoning around that. But the new billable on grade R potentially is at odds with this if children are going to be shifting more into the schooling system for that 5 to 6 year old kind of period. And I think it's also highly unlikely that we would see expansion in enrollment amongst younger groups unless the ECD subsidy was child age sensitive. And I'm going to show you this in an example now. So this is very just kind of back of the envelope numbers. But if we look at the child to practitioner ratio for different age groups that is in the Children's Act, it's 6 for children aged 0 to 18 months, 12 for 18 to 2 years, 3 to 4, 20 for 3 to 4, and 30 for 5 to 6. If we take a minimum wage for an individual in March of last year, it was 4,780 Rand. And so if you divide that across, say, 6 children, you would basically need each child to cover 797 Rand just for one early learning program practitioner. Okay. For children aged 5 to 6, you're dividing the cost of that practitioner amongst many more children. And so you would need basically 159 Rand contribution per month per child to that practitioner's minimum wage. The subsidy per month, however, works out at about 374 Rand per child. But if only a certain proportion of that can be spent on a salary, and actually this is more than what is probably required, what is allowed. I'm going to take 40% as a number. So you spend 40% of that subsidy per child per month on the the salary going towards the practitioner, you have a major shortfall, particularly for these younger age groups. A shortfall of 647 Rand per month to be able to cover a minimum wage for the early learning program practitioner, but only a 10 Rand shortfall for children aged 5 to 6. And this has major implications then for your subsidy. So it seems to be at the right value currently for 5 to 6-year-olds, but it's grossly inadequate to be able to cover a salary if we are applying the norms in the Children's Act around child to practitioner ratios for younger children. And so basically you having to, currently it would be the case that you probably are subsidizing younger children in the service of younger children through having older children in your program. But if older children start to leave because they're moving into the schooling system, this really presents a major problem. So in conclusion, under targeted early learning program enrollment, based on the 2030 population projection for children aged 0 to 6, almost 268,000 ECD practitioners would be required nationally to be compliant with child practitioner ratios in the Children's Act. But the Children's Act also stipulates that for each ECD practitioner, an assistant is required. So in total, a minimum ECD workforce of 536,000 practitioners and assistants is needed. This is more than doubling of the current total estimated ECD workforce, all staff, of 289,000. Is this an issue? I mean, I don't think we would struggle to attract a pool of candidates into the ECD system. It's unlikely to be a problem in a context of high unemployment, particularly amongst young people, particularly amongst young females. But I mean, people would need to get some kind of reservation wage, which is basically the minimum that they would be willing to work for. But this presents in itself an issue. So we want expansion, but we also want to see more training and more prepared individuals in this system. And so any ECD workforce expansion with respect to the number of ECD practitioners and assistants would have to be met with commensurate expansion and training, given the very low qualification and training levels that individuals currently have in the system. And then just to reiterate, the vast majority of the early learning practitioner expansion potentially relates to serving children aged 0 to 2. This also shapes future training requirements, because if practitioner engagements with children are to be developmentally age appropriate, then that needs to be taken into consideration when we are training early learning program specialists. And it also has significant financial implications for early learning programs, and especially government, if more 5 and 6-year-olds are accommodated in schools via grade R. So that is it. We are at the end, and thank you very much for listening and for going through this process that we've explained. Thank you very much.
Thank you so much, Gabby and Grace, for this very interesting presentation. I know we are pressed for time, but I would like to take a couple of questions or comments from the audience. The pressing ones, which is, can we have access to the presentation? We have obliged. You can see it in the comment section. We will also circulate the report that this modeling this presentation is based off on our social media platforms, and we will send it to colleagues who are attending today. So you will have access to the full report soon, and the presentation is in the comments. So if there are any questions, we'll take a couple, 1 or 2. I see one in the Q&A. So from Rebecca, she's saying this is such a great research and will have so many useful applications. The question is, when you model the workforce gap, did you layer in other demographic factors that would affect child-adult ratio? Or, for example, the estimated 1 million children deep rural areas, is it likely that ECD programs would be smaller and not delivered at full? So it's quite a dense question. I wonder if you can answer that and try and give a full but concise response so we can take a couple of more questions coming through. Thanks, Gabby and Grace.
Grace, go for it.
Sure. So that's a great question. And in short, no, we didn't. We estimated sort of national averages. And taking these kinds of things into account means that our estimations are really lower bound. So it's likely to be the best case scenario that we only need about 500,000 practitioners and assistants. But doing more regionally aligned and regionally nuanced work is really critical. And I think this is really just a starting point to do that kind of work. But it's a great question, and no.
Thank you, Grace. There's one question. I don't know if it is within our expertise here, but we can take a stab at it. So from Hawa, she's saying many private schools are reporting a drop in numbers of enrollment in 2025 for the ages 2 to 4. What can you attribute to this? You could give your professional guess here. It is beyond the scope of the paper right now, but any of you willing to take a stab at this, Grace or Gabby?
Hi. Yeah, I think that it's without having actually looked at the data itself, I can't give you an exact determination around that. But you know, we certainly see fluctuations in ECD enrollment estimates over time, and particularly around the pandemic and post that. Even in 2022, I mean, if we look at the GHS, there hadn't been a recovery in terms of the proportion of children attending any educational facility that are aged 0 to 5. It hadn't recovered to the same levels by 2022 that pre-COVID levels. We need to look at more recent data. I think the GHS 2020-24, when it's released, will be quite revealing. But I think with major changes around legislation recently, we really need more recent information for this year on that issue. And it's really trying to get a sense of how have numbers changed in the schooling system, particularly around grade Rs, and then have what's happening around proportional enrollment of children in early learning programs. But I just also really just want to emphasize before anything ends that the need for a electronic information system in ECD or the early learning program system is really vital, because we are dancing in the dark here to some extent, and I think we did somehow try to get that across. But there are just so many variables that range notably, and and we might be surprised when we start getting really kind of official data that is truly census-based around the system.
All right, thank you. There's a comment from Michael Sachs about if government plans to offer a significant increase in funding for ECD practitioners, it is likely that the remuneration will increase significantly above minimum wage. And this is quite interesting because obviously what we are discussing today has financial or funding implications. Expansion cannot happen without the necessary fiscal resources to support it. And interestingly, our next webinar is going to touch, I'm going to start the conversation on the money and funding aspect of some of the issues that we have looked at today and some of the issues we experience in the ecosystem broadly. So please do not miss it. It's going to be an interesting one. And lastly, there are lots of questions coming in, but because of time, we'll take just one final question. And the one speaks to the mobility of ECD practitioners or foundation phase educators into the ECD sector has been considered regarding the vast number needed to reach the expansion that we are calling on. So I suppose Venetia's question is that have you, or is this a possibility of moving ECD practitioners or foundation phase educators into the sector to address some of the gaps that we are looking at this morning?
Grace? No, you're muted, Grace.
Excuse me, I was just answering a few questions in the chat. I didn't. I believe it was the question around sort of. Sorry, I'm a little lost. I was just typing some answers.
So I'll help you, Grace. The last question I wanted us to engage with is the possibility of moving ECD practitioners or foundation phase teachers from the foundation phase into the ECD sector. Is it a possibility to address some of the workforce gaps that we have highlighted as a possible solution?
I mean, I'll let Gabby weigh in on this as well, but I think this work was really just looking at what we need, and where we go from here is up for creative solutions. So I guess possibly and thinking about incentives or how to fill in those gaps, but an estimation of the gap is I think a helpful place to start.
So Elizabeth, I think it comes down to, it's related to Michael's question. I mean, we risk, so at the end of the day, it's about, there's often about is this a survivalist activity, or can I make a decent, can I make a living out of this as a job? ECD has been a sort of survivalist activity. In fact, it's half of those that are in the sector are, classified as being informally employed, and that's been the nature in which it's operated. I think we really stand in a very tricky situation where we risk trying to pay people more and not necessarily address quality. And it's really not a situation we want to be in. So, and I really think this is a current threat for us right now as a system, where people just get more, that salaries for ECD practitioners get raised up to get closer and closer to something that people are paid in schooling. And we really have to deal with this issue of what about the other quality aspects that are really important. And I don't think that necessarily being paid more is always going to result in some of the changes that we need to see. I mean, what about when we see it in schooling, where there's so little money often left over after paying for salaries for books, for desks, for infrastructure. And there are major backlogs in this regard in programs. And to have a really well-trained ECD practitioner, but has nothing to stimulate a child with, is not a situation we want to find ourselves in. We don't want to find ourselves in a situation where we're paying so much to individuals, but we cannot address the really lack of safety in some current ELP environments, where actually the facility is just not safe enough for children. And so this is going to be a major tension and trade-off. And the whole time, we're going to have to be asking this question: is additional investment resulting in higher quality early learning programming for children? And we know up to this point, unfortunately, that from some of the work that we've been doing on looking at the connections between early learning outcomes and exposure to early learning programs in South Africa, for the most part, it doesn't seem to be a very strong link for the majority of programs, at least the bottom 80% in terms of the poorest programs in the country. And this is really, there's a backlog with respect to, and a constraint or bottleneck with respect to quality. And we have to very carefully ask the question, what is the thing that's going to shift quality? And it might not necessarily be pumping a whole bunch more money into above minimum wages, for example. All right. But that said, I just also, we certainly don't want to disqualify individuals. Yeah. And not earning a minimum wage is really not a viable life strategy. And so we would want individuals to be getting at least something that is a decent wage where you can pay your family and have a respectable life and a reward from a very important endeavor.
Thank you so much to Grace and Gabby. It pains me to end the conversation here this morning because it's quite a lot. The questions coming through are giving us some ideas of where we need to also put effort into deepening the research and the conversation around the issues that are pressing and high on the list in the sector. As I said earlier, the research paper or report that this presentation is speaking to will be circulated, so you have an opportunity to dig deep. You are welcome to also email us any further questions or correspondence, and we'll be happy to provide as much information or detail as we can in the future. Thank you for joining us, and it is a wrap for today. Have a good afternoon. Thank you, Grace and Gabby, for sharing your modeling experience and obviously ideas with us this morning. And we hope to see you soon in another webinar.